Hi friends, this is Juliet from Prega News, and today in this video we'll discuss about early signs of ovarian cyst which most of the women are not aware of. So let's check out what is there in this video. Symptoms are the body's way of telling us that something is wrong. Many are easy to shrug off because we often attribute them to something else. We are fatigued because we haven't been sleeping enough, bloated because we ate too much. Ovarian cysts that are benign go away naturally on their own without needing treatment. As the cyst grows, more symptoms are likely to appear. Polycystic ovary syndrome can be developed in women whose ovaries contain a large number of small cysts. In order to prevent such complication, you should note down all your symptoms you experience and how often these occur as the information before you meet your doctor. Early warning symptoms of an ovarian cyst include abdominal bloating or swelling, painful bowel movement, pelvic pain before or during the menstrual cycle, painful intercourse, pain in the lower back or thighs, breast tenderness, nausea and vomiting. So let's check out how it affects us. We'll start with painful bowel movement. Ovarian cyst can cause bowel movement complication because of how close the ovaries are to your bowel. Any growth that develops in the ovaries can press against the bowel. This can then affect not only how much your bowel can hold, but also the ease with which its contents can move. You will experience this symptom if your cysts have transformed into large cysts. You may feel pain when trying to empty your bowel. You may also find it difficult to completely empty your bowel. The large cyst pressing against your bowel may affect the muscle contraction and relaxation process that is necessary for bowel movement, and thus increasing the need for you to visit the loo more frequently. Treating difficult or painful bowel movement. Treating this symptom is a little bit tricky because a physical barrier is what is causing the symptom. Painkillers might help to make the pain tolerable, but still it is a physical barrier that is pressing against your bowel. There are therefore only two solutions that can really help to solve this problem. One is shrink the ovarian cyst. Second is remove the ovarian cyst. There are natural methods of treating ovarian cyst. These methods usually work by restoring balance in your body. They therefore work with your body, help get rid of the condition that created the environment that enabled the cyst to form and grow. By so doing, these natural methods of managing ovarian cyst can help to shrink the ovarian cyst. This can then reduce the pressure on your bowels. As for removal of the cyst, this is something that can only be done through surgery. It may call for undertaking more than you are comfortable with risk, but it is sometimes necessary, especially when the cyst is so large that it leads to other medical complications. Pelvic pain before or during the menstrual cycle. Pelvic pain during the menstrual period is known as dysmenorrhea. The reason for dysmenorrhea is a condition called endometriosis, when endometrial lining is outside the uterus. At the time of men's hormone level fall and uterine skin lining, that is endometrium, slows. This produces bloody menstrual tissue called mens as long as the tissue can exit the body. If there is any blockage to egress, pain is the result. Several different conditions can block menstrual egress and thus result in painful mens. Painful intercourse. The neck of the womb, that is cervix, should not normally be painful. However, if can become infected by many of the organisms which can infect the vagina, particularly herpes. If the cervix become inflamed, then knocking it with the penis during sex may cause deep pain in the pelvis and sometimes across the front of the thighs. The cervix may also become tender and sensitive if you have an intrauterine contractive device, particularly if it is sitting a little low or falling out. This can cause sudden sharp pain in the cervix during sex. Fortunately, cervical cancer is very rare and does not usually cause painful sex. How is the presence of ovarian cyst diagnosed? An ovarian cyst can be diagnosed in the following ways. First is the physical examination. If you experience any of the above mentioned symptoms, your doctor might first do a physical examination to ascertain the same. Ultrasound. An ultrasound is the best way to determine the position, size, and severity of a cyst present anywhere on the ovaries. CT scan. A CT scan would be further done to differentiate a benign cyst from the malignant one to assure the right treatment for the same. Next is MRI. An MRI is also an effective way to have a look at the cyst to ascertain their nature, severity, and growth. Blood test. A CA-125 marker test is done to check the potentiality of the cancer due to ovarian cyst. CA-125 blood testing can be used as a marker of ovarian cancer, but it does not always represent cancer. It may be normal in the presence of malignancy too. CA-125 is a protein that is elevated in the bloodstream of approximately 80% of women with advanced ovarian cancer. If the report indicates the chance of cancerous cyst, further screening for the cancer is recommended. How is ovarian cyst treated? The treatment of ovarian cyst depends on three factors: the age of the woman, the size of the cyst, and its appearance on ultrasound. Medical observation. If a woman is in her early 40s or younger with regular menstrual cycles, most of the cysts developed would be physiological in nature, like follicular cyst or corpus luteum, as I have discussed in my previous video about corpus luteum. They usually don't have any medical consequences and would disappear on their own. For women who are in their 20s and 30s, these cysts are observed for some time to verify if they disappear on their own. Cysts that are benign are usually closely monitored unless they call for emergency attention like surgery. Next is surgery. Both malignant and benign tumor would need surgical intervention. If a benign tumor ruptures and bleeds, it would call for an emergency. If diagnosis shows the presence of a malignant tumor or cyst, a surgery is always recommended to stop further spread of the condition. A cyst is usually removed laparoscopically after complete examination and request test done to ascertain its severity. Now we'll come to know about the severe symptoms of an ovarian cyst that require immediate medical attentions. Those include severe or sharp pelvic pain, fever, faintness or dizziness, rapid breathing. Hope you guys from this video have been aware of all kind of symptoms for ovarian cyst as well as how to get treated for an ovarian cyst. Thank you for watching my video. Please do not forget to subscribe, share and like my channel, that is Prega News. Thank you.